Next one we will be talking about is your abdominal aortic aneurysm. Everybody have heard about that one. Abdominal aortic aneurysm. So we call it AAA. AAA. So we know that this is a really medical emergency. So how do we describe it? We can say that patients have what we call dilatation, dilatation of the abdominal aorta. So when there is dilatation of abdominal aorta, it can rupture if it gets too large. So the aorta, the abdomen, the abdominal aorta. So when it dilates, it's like the way you blow a balloon. When it dilates, it gets so large that it can rupture. Just think about that. The abdominal aorta. Okay. Then it's always often asymptomatic. Patient don't even know what is going on. Okay. Patient don't know what is going on. But before you know it, they will have what we call proximal abdominal mass. Proximal abdominal mass. And it's always common. The risk factor is usually um, male, smoking, hypertension. Male, smoking, hypertension. So remember that we say that from the word abdominal. So the aorta, you can see the diagram, the aorta. So when this aorta, look at this normal size of aorta, very kind of narrow. Did you see this one? But when they have AAA, it becomes big. See how big it is here. It becomes big like you are blowing a balloon. So it is that enlargement, or you can say it's like it's getting dilated because it looks big. Dilation. It looks bigger. And the more it gets bigger, it can do what? It can rupture. So when it ruptures, that is what we are talking about. It ruptures. It ruptures. So the most thing to always remember here, we say the risk factor. I have the risk factor: smoker, male, hypertension, very high yield. Very high yield. Another thing they can ask you about this abdominal aortic aneurysm is the presentation. Presentation. And I broke it down like this: SIPA, SIPA or SEPA. What is that? It is a severe, sharp, excruciating pain. And remember, pulsatile abdominal mass. So SEPA, SSEPPA, severe, sharp, excruciating pain, pulsatile abdominal mass, and also it radiate to the back, to the neck, and to the arm. So another important thing they can ask you about abdominal aortic aneurysm is, what do we see in the X-ray? What do we see in the X-ray? We say that when they do an X-ray, use the mnemonic TOW, TOW, TOW. What is TOW? T is they can see a tracheal deviation. O, they can see obturation of the aortic knob. W, they can see widened mediastinum, very high yield. A patient presents with AAA, abdominal aortic aneurysm. And I said it, abdominal aortic aneurysm, this aorta, you see this aorta, this diagram here, here, this aorta, it becomes, it keeps dilating. You can see how big it is here. It keeps dilating or increasing in size. And if care is not taken, it is going to rupture. Sometimes patients will be asymptomatic, they don't even know what is going on. And that is why this is a risk, like so many people lose their life from this. 1 minute they are okay, then this rupture happens. Before you know it, they are taken to the hospital. They will not make it, and patient is going to have that excruciating and tearing pain. And you, of course, the blood pressure will be very high. And I say that the risk factor which we must know is that age, male, and smoking and hypertension. So include the smoking, hypertension, age, the person's age. So it is always recommended that um, the one-time abdominal ultrasound, at least for people that have smoked, they can do a one-time abdominal ultrasound. So if you have a patient who is a smoker and patient is 65 years to 70, so let me include it here. So if you have a patient who is a smoker and patient is 65 to 75 years, you can offer that patient one time abdominal ultrasound, and they usually do a surgical repair if it is greater than 5.5 or if it is rapidly expanding, because you don't want it to rupture. So they can do one time abdominal ultrasound. Mm. One time abdominal ultrasound. So one time abdominal ultrasound for men 65 to 75 who has ever smoked. Very important. And they can also do a surgical repair if patient is, if he is usually considered when it's greater or minus 5.5 centimeter.